Well, good morning, everyone. I'm Dr. Laura Lacher, and welcome to this week's Medical Grand Rounds. We'll get started with some logistics and then introductions for today. Next week, be sure to also join us for Grand Rounds. We will be hearing the talk Long COVID, Chronic Fatigue Syndrome, and Other Medically Unexplained Symptoms. It should be a very helpful talk given by Dr. Becca Kennedy. Just as a reminder, Grand Rounds is now a joint project between Providence St. Vincent and Providence Portland Medical Centers. We are often here live in person at St. Vincent's in Souther Auditorium on Tuesday mornings at 8 a.m. And we are occasionally live in person at noon on Tuesdays at Providence Portland. You can always join us live virtual on the Teams Live platform. And you can earn CME credit by being here in person in the room, by watching live virtual, or by watching a recording of the event. Each week, the Grand Rounds reminder and invite will let you know where we will be meeting, and you can use that same link to watch a recording of the event. I'll be monitoring the Q&A throughout today's session, so for those of you watching online, please go ahead and post any comments or any questions you have, and I will mostly hold those to ask our speaker at the end as time permits. And now to introduce today's speaker, we are joined by Dr. Craig Williams. He is Clinical Professor of Pharmacy at Oregon State University and Associate Professor of Medicine at Oregon Health and Sciences University. He received his PharmD degree from the University of California, San Francisco, and then completed residency training at Cedars-Sinai Medical Center in Los Angeles. Dr. Williams' research focuses on the use of applied pharmacotherapy to mitigate and manage chronic diseases with particular emphasis on cardiovascular health. His current practice is with the Division of Family Medicine at OHSU, where he practices in both the inpatient and outpatient settings. Dr. Williams is a skilled and generous teacher. We are so delighted to have him back here at Providence. Welcome.
Yes, thank you very much, Laura. Thanks for the introduction and thanks for the invitation to come back. Yeah, it's been a few years since I've given Providence Grand Rounds, and last time I was at Prov Portland, so I'm happy to be here. So as Laura said, I will leave time for Q&A at the end, but I'm happy to be interrupted and have questions during. So if this is a little bit of discussion format, that's fine with me, but there should be time for questions at the end. And yeah, I titled today's talk Vitamania, Regulation, Data, and Consumer Choices, and we will spend a little time on regulation, how we kind of ended up where we're at now with regulation of supplements. As you guys are probably aware, there's news coming out of Washington every day of changes in regulations and federal workforce, and so I can guarantee you there are not more people working at the FDA now than there were last year, and they were already a bit understaffed to do what they were doing, and I'll say a little bit about that. So things are changing in real time on this topic. I'm also down the lower right corner there, my email. I'm happy to receive email questions later. If you think of something great a week or a month from now, feel free to drop me a message. I'm happy to respond, and I have no conflicts of interest with anything that I'll be talking about today. So let me start with a couple, just kind of in case I lose anybody halfway through or it's early on Tuesday morning, just a couple kind of truisms here, and then we'll get into some of the meat of the talk. In case anyone was hoping I was coming up from the Linus Pauling Institute with great data that vitamins cure long COVID or anything you might be talking about in the future. I, in fact, will not be doing that. So I will say vitamins generally don't help healthy people, but we'll put a bit more context around that. But as we'll say, they are vital amines, which is where the name derives from. And the third point there, no question we need to avoid vitamin deficiencies, but generally not what we're thinking about or worrying about in 2025. But let me introduce you to one of our patients. I met this young man, or I guess not young man, mid-50s. Alcohol use disorder is on our service about 3 years ago now, March of 2022. So presented with bilateral upper thigh ecchymoses, no trauma history. So we spent a little time scratching our heads and then fairly quickly sent off a vitamin C level, which was undetectable. In fact, this was the early stages of scurvy. So as our hematologist remind us, vitamin C levels are notoriously kind of labile, but the real kind of test is give vitamin C, and if it gets better quickly, that was definitely early scurvy. So this was in 2022. So I think probably all of us in medical or pharmacy school learned about manifestations of vitamin deficiencies, but probably haven't seen wet beriberi or dry beriberi or rickets or hopefully scurvy. I'll have in a couple slides my second case in like 10 years up at OHSU. So occasionally we see deficiencies, but that's certainly the exception. And I think anybody who's asking us for advice about vitamins these days is worried about getting scurvy or rickets. So no one questions the value of repletion in deficient patients, but that's the exception. So the real question we have for today is, what's the role of supplementation in folks that are otherwise generally healthy? And how do we kind of counsel around that, or how do you want to approach patients about that data? So to get there, I'll kind of spend a little bit of time on a couple different areas. Again, we will talk a bit about the regulatory background here. We'll say a little bit first, like what are vitamins, what do they do, and what should we kind of know about them, and answering our patients' questions about them. I'll give you a little bit of background on the regulatory environment and kind of how we ended up here. As I say, that's changing on probably a regular basis, but safe to say with the current Secretary of HHS, we probably won't be getting any more regulation around supplements and vitamins. So it's probably be a bit of the Wild West here for the next several years still for what people want to take and why they want to take it. 3, why natural may not be the way to think about natural products. I'll say a bit about that. We really offshored manufacturing of lots of things. That's in the news just this morning. Pharmaceuticals, prescription pharmaceuticals probably coming up on the federal list here soon. But for supplements and so-called natural products, we offshored that a while ago. And we'll say a bit about the data and where we're at in the United States. Preventive Services Task Force just came out with a relatively recent review on this topic, so they made our work a little bit easy for us. And then talk a bit about what now then, given that data and regulatory environment. And I'll say a bit about kind of how I approach this topic with my patients, and be curious to hear how you guys might approach it with your patients. So already a round of applause, and we're barely beginning. So first, what are vitamins? It's a great great question. So just to remind you guys, the name does derive from vital amines. They're not all amines, which is a nitrogen containing chemical compound, but many of them are. So that's where the name derives from. We all learned in schooling there are 13 human vitamins. So A, D, E, and K are fat soluble, and we maybe got a question right on exam or boards, remembering ADEC as the fat soluble vitamins. There's only 2 others than C and B, but there are 8 B vitamins. So in all 13 vitamins, but classified into 6 broad categories. They're all considered essential micronutrients. So micronutrients distinguish from macronutrients, have their macronutrients give us our calories, fat, carbohydrate, protein. And essential because they have at the bottom of the slide there, we need them from our diet. So we no longer make vitamins. But interestingly, we all have the DNA machinery in our cells to make vitamins. So the kind of the remnants of them are there, but our ancestors have been eating so much vitamins the last many millions of years that we no longer make them. In fact, as our patient with scurvy demonstrated, if you become deficient in a vitamin, you can't turn that machinery back on. So essential because we have to acquire them from our diet. But what are they? How much do we need for them to do their job? Boy, I wish I was next door. There's something great going on behind us. This is the way I kind of think about them. This is not universally true across all 13. This is generally true. Vitamins really intracellular catalysts and do something critical that can't be done if they are not there. And vitamin C is a great example of that. And did show a picture of scurvy. Scurvy does still occasionally come up in the modern era, but I think if you're into maritime stories or movies, we've all seen depictions of scurvy. So it's a relatively well-known vitamin deficiency, even to the general public. And it's a good example of what vitamin deficiencies manifest. So I have in the middle part of the slide there, collagen is made from procollagen, and that reaction is catalyzed by vitamin C. So no vitamin C, eventually no collagen. And literally that's the stuff, the glue that holds us all together. So if you've seen it depicted in movies, people kind of start melting from the inside. And if you want a good movie this weekend, I can recommend Master and Commander with Russell Crowe, which actually had a nice depiction of scurvy in it. So a little bit gross, but teeth falling out and insides melting. And but really a pretty impressive disease process and a nice example of just what vitamins do and how critical they are. So in small amounts, we absolutely need them to avoid some pretty horrible diseases. But as Evan Bold there, it'd be a very rare patient that we're worried about scurvy in, or that's not why they're taking vitamin C, certainly in 2025, or they're not taking vitamin D for concern about rickets. So how much do we need to do this vital job? And then what's the evidence for supplementing, as we'll get into. Let me say a little bit about the recommended daily allowance, because I think there's some misunderstandings about this, certainly among the public. And you can Google RDA and type in your vitamin and certainly find the number. And I know patients do this because they come in, they bring in sheets and they ask me about it. But what is recommended daily allowance? This is the amount of vitamin you need, the upper 97% of the population needs to avoid deficiency. So in other words, 97% of people could get by with less than this amount of this vitamin. So it's a recommended amount that essentially the lower 3% of the population needs to avoid an outright deficiency. It's not, as I have in the middle there, an average daily need. It's not a goal for patients. So hopefully no one's counting up their vitamin Ds and vitamin Cs in micrograms every day and trying to assess if they're achieving the goal. Part of the reason you can go for a long time without consuming vitamins before you get deficiencies is they work inside the cells and their biologic half-life is quite long. So if you look up vitamin C and Micromedics or on UpToDate, it'll say the half-life in the serum is about 10 hours, but the biologic half-life in cells is as long as 40 days. So the efficacy inside cells is measured in weeks. Half-life in blood is measured in hours. So big difference. So again, the RDA is not a daily goal, and 97% of people don't need that much to avoid a deficiency anyway. So vitamin C, I'll say a little more about vitamin D as I have on the bottom there. I think that became a very popular vitamin in the last decade. We were all maybe told we were vitamin D deficient or insufficient, living kind of north of the 45th parallel. How much do we need to avoid a deficiency? The RDA have down there at the bottom for vitamin D is 600 international units, which is 15 micrograms, which is 4 zeros before the 15 for 0.0 grams. It's about 1/10 of a grain of table salt, just for kind of reference. The recommended allowance for B12 is 1/7 of that, so 2.4 micrograms. So almost hard to imagine how small the amounts are that we need to consume. If you're eating food, you're getting vitamins. So there's a lot of unhealthy foods out there from a macrovascular standpoint and macronutrient standpoint, but generally speaking, food has vitamins. So very hard to get deficient, unless again, like our patient, it's, alcohol is 99% of your calories. So need very small amounts of vitamins to do their job inside cells. So they work inside cells. They last a long time. Again, the serum half-life does not reflect the biologic half-life. If you go back to those like maritime stories of scurvy, it typically was a minimum of 6 to 8 weeks, kind of having left port before you saw the first symptoms of scurvy begin to develop, and that was with zero consumption of vitamin C in that previous 6 to 8 weeks. So it takes weeks to months for deficiencies to manifest. But as I have in the middle of the slide there, this is America. If a little is good, perhaps more is better. And certainly I think all of us could forgive our scientific ancestors of 100 years ago. When you discover that such a small amount of vitamin C can cure scurvy, it would be natural to wonder what could more vitamin C then do? This kind of small compound could do such a miraculous thing. What if I consume 10 times or 100 times what I needed to treat scurvy? What are the benefits might I see? So I think an easy thing to think about or assume 100 years ago, but as I'll share, we have a fair amount of data now to talk about that. So what could larger doses do? And before we get there to the data, let me say a little bit about the regulatory background, which probably is changing on a fairly regular basis these days, but it is a bit interesting how we got to where we're at in 2025. And if you guys have walked into a supplement store or even most pharmacies and gone to the supplement section, it's a pretty big shelving display with, as you probably noticed, all kinds of claims for health benefits. If they actually worked the way they kind of implied they worked, we'd all be out of a job a long time ago, and it'd be great if we put hospitals out of business with supplements. But I can assure you we're nowhere close to losing our jobs because supplements are not going to make the population so healthy that we won't need hospitals anymore. But how do we get to where we're at now with regulation? Interestingly, if you go to the FDA's website, and actually we just gave a talk at an internal medicine meeting last week, and we used some stuff at FDA.gov, some package labeling, and there's some wonderful resources at the FDA website, certainly for the time being. But if you go there to find information on supplements, you have to go to the food section. So FDA.gov and then /food. So when you go to the homepage, when you scroll down the section for drugs, and you got the section on foods to find information on supplements. There's some information for the consumer there that's easy to find your way to. I'll just point here, there's a dietary supplements section then. So we treat supplements like we treat food from an FDA standpoint. So go to the food section and dietary supplements. Here's a nice picture they had as of 2 weeks ago, and I kind of updated these slides. And you pretty quickly find your way to this statement, information for consumers on using dietary supplements. And let's highlight at the bottom here in bold, it says FDA is not authorized to review dietary supplement products for safety and effectiveness before they are marketed. And literally supplements kind of live now in the world that prescription drugs lived in 1938 when the FDA was created. In 1938, Congress passed the FDA and Cosmetic Act, created the FDA. The FDA basically had 180 days to review products before they went on the market. So when the FDA was created, there was no standard for efficacy or safety, but whatever company was bringing a product on the market had to notify the FDA they intended to market a product. FDA had 180 days and to say like, yeah, you can do that, or no, you can't do that. That's kind of where supplements exist. Supplements are assumed to be safe. There's no presumption of efficacy, but they're assumed to be safe. It's the burden's on the FDA to remove a supplement from market after it's been used if they find evidence of harm. But there's no burden for a company to show safety before the supplement enters the market. So it's an interesting place that we've ended up in 2025. A big reason for that is the DSHEA laws, the Dietary Supplement Health and Education Act, which passed in 1994, which is referenced there on that kind of main page at FDA. What was DSHEA? As I have in the middle there in red, DSHEA was passed largely by Senator Orrin Hatch, who was a senator for Utah at the time, pretty powerful senator back in the 90s. In the mid 90s, about half of supplements we consume in this country were made in Utah. It was a manufacturing hub for supplements. So Senator Orrin Hatch, along with the founder and owner of the supplement company Nature Made, who spent a fair amount of money on this. There were advertisements. You can go to YouTube and find some of the advertisements for DSHEA back in the early 90s. Mel Gibson famously made an ad where he was like dropped from a helicopter in a home and he was pretending to be the federal agents coming to take away your supplements. And so there was actually some national advertising to pass DSHEA with some kind of Hollywood stars paid to star in commercials. But DSHEA did pass in 1994. What DSHEA did was exempted supplements from NLEA, which is the statement just above that. So NLEA is the Nutrition Labeling Education Act. That was passed in 1990 by Congress, and that was in response to some deaths from L-tryptophan, so the turkey amino acid supplement. So it was sold in fairly large amounts for large quantities back in the 80s and 90s, and there were a few deaths from a strange eosinophilic reaction, almost an allergic type response, which at the time was presumed to be too much L-tryptophan, and we can basically mount a systemic inflammatory immune response. So in response to those deaths, Congress passed NLEA. NLEA was aimed at both food and supplements, and it was aimed both at the labeling and what's in the bottle. So they wanted to have some control over what the label says and what was actually inside the container. But DSHEA exempted supplements from NLEA. So to a large extent, our food is now more tightly regulated than our supplements, thanks to DSHEA. So due to that lack of oversight that existed well before anything going on these days in Washington, this led to a couple implications I'll just say a little bit more about. So with that relative lack of oversight of supplements in this country, one, there's no efficacy requirements. So standards for health claims can be about whatever you want as long as they're broad and vague. So if it's not something specific that can be refuted by the FDA, there's not a lot the FDA can do. And if you reach out to the FDA or call the FDA, they'll say, look, we don't necessarily like this situation, but Congress basically kind of tied our hands. So they say on their website, we don't have the ability or the rights to review this information. Number two, the lack of oversight does extend to manufacturing. That was well before anything going on now. So in the 2000s, most of the manufacturing moved overseas, mostly to China and India, which obviously gives the FDA very little oversight over what's coming onto our shores and being sold in the drugstores. So to kind of exemplify the first point, these efficacy standards, it's kind of interesting. So I went to Centrum's website, the most popular multivitamin in this country. And if you go to Centrum's website, there's a section to help you choose what vitamin is right for you. You can choose your Centrum. So I clicked on that and you take, I think it's a 5-question quiz, doesn't take very long. So I took the quick quiz and pretty quickly was directed towards Centrum multi-gummies for adults 50 plus. So this was what they felt was the best product for me. So I'm not sure why multi-gummies. My dentition is fine. I'm a Providence patient, so my teeth are in good shape. I am over 50, so I guess that makes sense. So when you click on the product then, multi-gummies for adults 50 plus, here are some of the benefits that are listed. You know, if you can read that from the back of the room, but the product benefits of Centrum multi-gummies for 50 plus adults includes heart health. Says down there, B vitamins help promote heart health, brain function, zinc and B vitamins, key nutrients for brain health, general wellness. So some pretty broad but vague health claims. So who wouldn't want brain function and general wellness? You click on the vitamins and minerals section and find out about specific things in there that Centrum feels they do. So it says there for vitamin E in the upper right corner, central to healthy bones, influences cell growth and immune function, to keep inflammation in check. Vitamin E over in the middle on the left, mainly function in the body as an antioxidant, supporting heart and eye health, plays a role in immune function. So lots of interesting vague claims You'll note after each of these, there's an asterisk, and actually on the previous slide, after those health claims, there's also an asterisk. If you scroll down the bottom of the page on Centrum and any other vitamin site you might go to, there's a small disclaimer, which I'll kind of blow up here for you, and it says, this statement has not been evaluated by the FDA. This product is not intended to diagnose, treat, cure, or prevent any disease. So when you read the labeling or what's on the website, it certainly sounds like they're promoting them for health, but then they kind of wave it all away with this disclaimer that this product is not intended to diagnose, treat, cure, or prevent any disease. So again, it's an interesting situation that we're kind of in this middle ground with FDA's hands being fairly tied by DSHEA. But again, if you're walking in the drugstore and grab something off the shelf and look at the labeling, it's all legal, but it's certainly not very ethical. All right, so since DSHEA passed and Leah's been in place, supplements become pretty big business in this country. So as of the latest NHANES data that I could find in 2018, about half of adults reported taking a supplement. Around a third reported their kids took a supplement, which means a third of adults are giving supplements to their kids. I don't think many kids are taking supplements on their own, but pretty big business. And dollar-wise, about $40 billion, which is a lot. And just for context, we spend about $500 billion on prescription drugs, so 500 billion on prescription drugs. And you guys all know how expensive prescription drugs are, but we're approaching 10% of that on supplements. So pretty big business, which has certainly shaped some of the decisions in this country around them. For those that might kind of read the popular press, I noticed this article just a couple weeks ago in the New York Times. I just share because it certainly fits the story. The title is "The Story of One Woman Who Fell Prey to the Medical Freedom Movement," and it makes the point starting here: 1 in 5 Americans is using alternative medicine in place of conventional medicine at some point. I didn't click on that survey, know where that data came from, but that's certainly a believable number to me. They go on to say here, they cite actually DSHEA, so it's interesting. They cite the 1994 Act that we were talking about, that, as they say here, which curtailed FDA oversight and made it cheaper and easier to bring junk supplements to market. So junk is their word, not mine, but it's true. There's not much data behind these, but DSHEA did kind of enable a lot of where we've ended up in 2025. And then since I work it up at OHSU and we're certainly hospital, and I'm here at your hospital, I'll just mention they had a statement in there saying many hospitals and medical schools have responded to the surge in patient interest in wellness by inviting elements of that into their community. So it cites there the number of hospitals with complementary and alternative medicine services grew from 8% in 1998 to 42% in 2010. So I don't know what's offered here at Providence, but certainly at OHU, we do have some inpatient acupuncturists and inpatient wellness that again is, I think, larger in response to patient demand, not clinicians feeling this is something we have to have on the inpatient side. But I think the healthcare system is responding to some extent to patients' desires for this. But it's an interesting article, and again, as you can imagine, the patient didn't do too well with her natural products. She had breast cancer from the article. All right, let me say briefly then, so efficacy standards are very lax. Companies say a lot of what they want as long as they're general. FDA can't do much about that. But this lack of oversight does also extend to manufacturing, which is largely moved overseas, which leads into the third topic here, which is natural products are far from natural. When you ask patients, I find these to be kind of great kind of gateway drugs to talk to patients about their goals for their health. So I don't get asked all that often by patients for recommendations on or advice about supplements, but if you ask them about supplements, you'll often learn a lot. So it's a great time then to ask them, like, why is it you're taking this, or what is your goal for yourself? When we ask them, we talked about their natural products. I think they literally almost kind of envision, as I said before, like little Keebler elves squeezing sun-ripened fruits into capsules, and there's no conception of where these compounds come from that they consider natural sitting on the store shelf. I'll share you a paragraph from a book called Pandora's Lunchbox. Melanie Warner is an investigative journalist who's done some work in this kind of supplement vitamin area, and her book's titled again, Pandora's Lunchbox. Great read if you're interested in this topic. And this is the excerpt from a section on vitamin C. I'll just read you how vitamin C is actually made in the 2020s. Melanie reports there, commercial vitamin C, which is ascorbic acid, typically begins as sorbitol, which is fermented in bacterial broths, to sorbose, which is fermented further in a broth of genetically modified bacteria, to 2-ketogluconic acid. That is treated with hydrochloric acid to form crude ascorbic acid, which is filtered and purified to vitamin C. So really, to make these a profitable business, it's become a kind of a chemical industrial process. So about as far away from small elves squeezing fruit into capsules as you could possibly get. And it's the same for all the other commercially available vitamins. So and even that discussion with patients usually kind of is a little bit eye-opening for them. They're natural in that they do occur in nature, but it's not natural how they got in that capsule that they're buying at the drugstore. And that's led to two consequences, this kind of offshoring and manufacturing. Unintended chemicals that shouldn't be in these products are in there, and then intended chemicals that shouldn't be in there are in there. So manufacturers can sneak things in there, and it's hard for the FDA to catch those. Then you can imagine this chemical industrial process leaves behind residues that can't totally be gotten out. And that's probably where a lot of the allergic reactions is coming from to these products, is not the intended products, not the vitamin C, and it's not the L-tryptophan, it's the contaminants in those products. There was an interesting article now a decade ago kind of on this topic. So the title here from the New England Journal of Medicine, Emergency Department Visits for Adverse Events Related to Dietary Supplements, which interesting, you wouldn't guess dietary supplements cause any visits to the emergency room. They surveilled 63 emergency rooms for a decade and then extrapolated that nationally. And their estimate was there's about 23,000 ED visits per year due to complications related to supplement use. What would that be? About a third of those were due to vitamins or things that fall in the micronutrients category, so including vitamins. So the category that includes micronutrients, vitamins, about a third of those reactions. What those reactions were, particularly to micronutrients, were mainly two things: dysphagia, so swallowing problems, having the middle there, which is kind of maybe tragically ironic that someone's taking this for the health, but literally choking on their pill. So dysphagia. Some of these are very large, kind of chalky supplements. So literally swallowing problems from the pills, but more commonly, mild to moderate allergic reactions, it says there in the middle. So, and this again, probably not a reaction to what's supposed to be in there, but a reaction to other chemical residues left behind with this kind of commercial industrial process that's producing these products. There's been a lot of kind of research on this. So here's a relatively recent article from one of the JAMA journals. They grabbed a bunch of these products off the shelf and tested what is in them. About 43%, or exactly 43%, had ingredients listed on the label that were not contained in the bottle. So almost half didn't contain what they said was supposed to be in there. And about a third had substances detected that were not on the label. So other chemicals in there that were not supposed to be there. So again, difficult for the FDA to keep up on this even before the recent changes going on in Washington. And actually, coming back to our point about L-tryptophan, which kicked this whole thing off in the late 80s, the Congressional Act around labeling was kicked off because of L-tryptophan. It turned out probably it was contaminants in L-tryptophan that caused those eosinophilic reactions back in the early 90s. So probably was not L-tryptophan itself, but again, already difficulties with commercialized production of these other products. So probably contamination's been going on for a long time, even before getting recent changes. And I'll say briefly, intended chemicals that shouldn't be in there that get put in there. So if you go to that kind of that food and that supplement section, you can find your way pretty quickly to the recall section. Again, FDA does what they can in this area. I subscribe to that, so I get emails. Average, I'd say 1 a month with some new product that was taken off the market. I'll just share with you some of the ones taken off in 2024. I don't know what all these things were for. Force Forever there, dietary supplement taken off in December. It had diclofenac and dexamethasone detected. Something called Umeri, which I'd guess might be for GI health, contained diclofenac and omeprazole. Interesting combination to put in a over-the-counter. And then the bottom there for male sexual enhancement actually contains sildenafil along with the acetaminophen. I'm not sure why the acetaminophen with the sildenafil. So, but again, the things that shouldn't be in there do get in there, and the things that shouldn't be in there that the company may want in there get put in there. So again, the FDA, I don't know how much they test per month, but I can guarantee lots of things are not being tested per month. But when they are tested, they are taken off the market. And so again, I'd say that averages, I get about an email a month from the FDA about something else taken off the market. All right, so the wholesale movement of manufacturing overseas has, again, only worsened all this, as you kind of might imagine. But all right, so what is the data? So let's assume that your patient is getting a safe supplement. They're paying kind of top dollar. They're not choking on it. It's not causing eosinophilic reactions. They're getting some vitamin that they want to take. What is the data for it? As I said, the USPSTF made our work fairly easy here, so we could spend literally hours going through all the data. There's a surprisingly large amount of data on vitamins in particular in randomized controlled trials. So you could spend literally kind of weeks going through studies that go back to really the 1970s. But in 2022, the USPSTF released their latest report on vitamins. I'll just note here, it started with almost 38,000 articles, at least looked at the topic. Applying their kind of quality metrics and wanting only randomized controlled trials, they ended up with about 400 well-conducted, randomized, placebo-controlled trials. So still a pretty rich literature base in which asks the question, do vitamins work and how well do they work? The USPSTF organized this around 4 they called key questions or key Qs. These are the 4 questions they're trying to answer. Basically on the top there, what's the efficacy of multivitamins for particularly cardiovascular health, cancer, and mortality in general, which are typically the reasons that otherwise healthy people are taking supplements. Cancer and cardiovascular disease come up a lot when you ask patients, why are you taking this? So what's the benefit of multivitamins and what's the harms of multivitamins? And then what's the efficacy for single nutrients? So how does vitamin D do by itself or vitamin C? And then what's the harms of an individual nutrient? So 4 broad questions in which they had about 400 trials to look at. I know you can't see the details here, which is fine. I'll just share. Here's the kind of overall breakdown table. Let's call your attention over to the right-hand side. This is favors intervention to the left and favors control to the right. You can see there the first set of numbers over on the left-hand side is the number of trials for individual constituents as well as for multivitamins up top. And overwhelmingly, there was no benefit from vitamins they could find. There was one thing that kind of stands out, which was an increase in lung cancer from beta carotene, which is basically a pro-drug version of vitamin A. So, and this paper is pretty well known in the kind of vitamin supplement world. Just share it. This was published in 1994. An impressively large trial of 29,000 individuals followed for 5 to 8 years. So, as someone who's worked on clinical trials, it's impressive the volume of data we have on vitamins. So, a 29,000 patient randomized trial followed for 5 years. Average age of the patients was 57. Note in the title, these were male smokers, so patients at uniquely high risk for cancer. Makes sense to study vitamins in that setting if you think they prevent cancer. So study vitamin E and beta carotene in male smokers. And you can see on the bottom there, an increase in cancers, in lung cancers in this population from beta carotene. So the curve there is pretty clear. As they have on the right, the incidence of lung cancer was significantly increased. The mortality from lung cancer had a strong trend for increase, but an increased instance of lung cancer with beta carotene in male smokers. So it was a good study. It was an appropriate population, and obviously the event curve went the wrong direction. In the interest of time, I took out a few slides to like why this might be. It's an interesting question. Why would it be that a vitamin might increase cancer risk? There's still not fantastic data there, but as you guys know, maybe probably better than I, cancer therapy has very much gone the direction of immunotherapy. So, and we think that giving potent antioxidants to patients may suppress some of their own natural immune system. So our immune system now is hopefully taking out any early cancer cells we might be developing. And it could be that if we take mega doses of things, maybe we interfere with our own body's ability to kind of fight those early cancers. But certainly the finding here was significant. So we're not sure what's going on, but beta carotene including increasing cancer rates in male smokers. Interestingly, you don't have to worry if you're eating a healthy diet, the trend went the other direction for any dietary consumption of beta carotene or other vitamins. So there was pretty extensive surveying of diets throughout this trial. And so if you ate a diet healthy, rich in vitamins, the trend was the more vitamins, an inverse relationship with cancers here. So it's something about the kind of mega supplement doses here. I'm certainly not what we're getting in our natural diet. If we come back to this and if we look at the data, so multivitamins up top, beta carotene, vitamin A, vitamin E, vitamin D, calcium. See the numbers there to the right, the numbers of trials. These again are all high quality randomized trials that were occurring. Let me just say a little bit about vitamin D, because I think vitamin D has become the popular vitamin of certainly the 2010s era. So you can see there by far the largest number of trials, so 27 high quality randomized trials looking at all-cause mortality, 19 there for any cancers related to vitamin D. And I think as the data is coming out, particularly for the antioxidant vitamins, so A, C, the B vitamins, E, as the data really the 1990s, early 2000s, most data was in that those antioxidant supplements don't do anything to prevent cancer and heart disease. And I think kind of vitamin D was kind of the last vitamin standing. It's that people kind of realize that we haven't debunked vitamin D yet, so maybe vitamin D is kind of the answer. As I alluded to at the top of the hour, I think at some point we were all maybe told or felt we were deficient or insufficient. It was about a decade ago that suddenly everyone was deficient, and you couldn't go to a holiday party without someone realizing you're a writer and asking about their vitamin D level. Everyone was checking vitamin D. Everyone's being told their levels were low. The cut points that we still use OHU were from the old endocrine society guidelines that they need to be updated, but less than 30 was insufficient and less than 20 was deficient. So suddenly you feel like you're living a high quality, healthy life, but you were deficient in vitamin D. I hate to refer to New York Times twice in a medical grand rounds. Let me refer to it one more time here. There was a nice article right around the time the big randomized trial came out. An article appeared in New York Times titled there, "The Vitamin D, the Sunshine Supplement has shadowy money behind it." The depiction there, it's Dr. Hollick, who was the first author on the endocrine guidelines that established those cut points of 30 and 20 that we still use in practice. And it was a pretty well done article. If you Google that title, it'll still pop up and you can still read it. But they made the point that very few Americans, I think very few, including providers, that were swept up in the vitamin D craze. It says we're likely where the industry has sent a lot of money to Dr. Hollick's way, which was true. A lot of funding from the vitamin D industry of the clinician who was the primary author on the guidelines from the Endocrine Society that established our cut points. The study had just been announced. The results been announced. It was published shortly thereafter. So a lot of you are probably aware of the VITAL study. So we finally had a big randomized trial of vitamin D supplements for prevention of cancer and cardiovascular disease. I won't go into great detail here. I'll just mention, and again, another well done, large randomized trial. So it truly is impressive, the volume of data we have for vitamins. 26,000 patients followed for an average about 5 years. No benefit in terms of cancer or cardiovascular risk reduction. So no increased risk like beta carotene, but no benefit from vitamin D in 25,000 patients followed for 5 years. A couple years later, the bone incident fraction incident study was published. So same population, published in 2022, is a 2,000 unit dose they were studying here. And again, 25,000 participants, 5 years of data. No change in fracture risk in these adults either. And interestingly, in both trials, didn't matter what your baseline vitamin D was. So down there in the lower left, whether you were in the lower quartile, the upper quartile of vitamin D, baseline vitamin D did not predict benefit from vitamin D, either for bone health or cancer or cardiovascular benefit. So at that point, kind of the last big vitamin had kind of fallen. It took a while to get this study done, but we have this data now as of just a couple years ago. So coming back then to the USPSTF kind of guidance, clearly no benefit kind of generally across the board, a large number of trials. You can easily find this on their website. I sent it to a couple patients we have patients who are really pretty into vitamins. So I've actually shared this with a couple patients and a number of the family clinicians that I work with up at OHSU. I wouldn't say it's a scathing report. They leave kind of room to how you want to counsel your patients, but certainly they make it clear they couldn't find any evidence for benefit, including any subgroups by gender, by age, by baseline risk factors. It appears that if you're already a well-formed adult, vitamin supplementation, if you're eating food, just does not seem to have any benefit. Again, I won't go through the older trials. Go to New England Journal. This one you can see there is their beta carotene trial that showed increased cancer risk, but it was one of among about 4 trials published in the mid-90s in the New England Journal of Medicine, all of which had more than 20,000 individuals, followed for a minimum of 5 years. So again, it's very impressive, the volume of data we have. So it's not that we don't have data for vitamins. We have data and they're negative, but I think a lot of people have lost a little bit of track of that. If you've been kind of following just the medical literature in the last kind of 20 years, there's been more that's popped up. So the HOPE trial, which I think a lot of us think about as the ramipril study of ACE inhibitors, had actually a homocysteine arm. So the HOPE homocysteine arm, homocysteine did not work. The HOPE-2 trial looked at vitamin E, that also did not work. The heart protection study, which I think about as kind of a simvastatin trial of 20 years ago, also had an antioxidant arm, that also did not work, and again, 20,000 individuals. So a lot of data that went into, and those are just 8 of the trials that are kind of among those 400 that USPSTF found to make their recommendations. So again, they could not find benefit for any subgroup that they could look at either. So what did USPSTF end up doing? They said certainly it's fine to use folic acid for pregnant adults or those trying to get pregnant. So that's still a valid use of vitamins. Otherwise, they said do not use beta carotene vitamin E for your high risk patients. So the D grade there for beta carotene vitamin E for prevention of cardiovascular disease and cancer, the numbers went the wrong direction. That was in male smokers in particular. And otherwise, they just said there's just not enough data. We can't recommend vitamins for anybody else besides folic acid for your pregnant or adults trying to get pregnant. So they probably, a lot of us think they probably should come out and just kind of recommend them more strongly against vitamins in adults, but they just basically said there's no data in favor of them, so we can't recommend them for anybody. So, and across the board, generally, we don't recommend these for your healthy adults. So what do we do now? Because we do live in an area where there's a lot of interest in supplements and vitamins. And I moved out here 20 years ago from the Midwest. There's definitely a healthier lifestyle in the Pacific Northwest. There's more interest in natural products, what's considered natural, though, as I said, grabbing vitamin C off the shelf is not a natural form of vitamin C, but there's definitely interest in kind of alternative medicine here, more so than other parts of the country. I think we'd have to decide in our practice, how are we going to approach vitamins? Because a lot of our patients are convinced that they are being helped by them. And I'll share the kind of my general approach. Let me show you the kind of what I'd call the USTS PSTF approach. So they first did a meta-analysis on this back in 2013. So about a decade before that 2022 review, the USPSTF did a similar meta-analysis. It was similarly negative, as you can kind of imagine. And I'll share, this is the editorial to the 2013 USPSTF analysis. And it said, enough is enough. Stop wasting money on vitamin and mineral supplements. So a little bit paternalistic, and not an approach I think that will work all that well with patients if we kind of came at them as I'm here to take away your vitamins and convince you they don't work. A little bit of a heavy-handed approach. The editorial that accompanied their latest review, the one that we just kind of went through in 2022, this editorial said multivitamins, supplements, benign prevention or potentially harmful distraction. I think that's probably a better way to think about supplements in the hands of our patients in 2025, particularly if it's a patient who feels like this is really helping me. So as I tell them, I'm not here to take away your vitamin, but I am interested in discerning, is this a benign prevention? Meaning, are you an otherwise pretty healthy person who's not having any trouble affording these supplements? Or is it a harmful distraction in that you continue to smoke or live a very sedentary lifestyle? And are you taking this vitamin thinking it offsets some of your, what you know are unhealthy behaviors? So I think it can be a harmful distraction for some patients. Or again, a benign prevention if someone's living a healthy life and just thinks this is going to put me over the top, give me a bit of an extra benefit. I think you have to decide kind of what can't be going. And so I approach it differently with different patients. But again, my approach, I'm not here to take away anyone's vitamins if they feel they're helping, and it seems like it's a benign prevention situation. So otherwise healthy adult that wants to spend their money on that vitamin. However, I do think there's some patients who avoid or delay what they probably know are healthy lifestyle changes and figure, well, pop the multivitamin, that'll kind of make up the difference. And so if that's the approach, I do try to at least enlighten them on the data we have and kind of bring them around. So it's maybe better, let's try to lose some weight. Let's stop smoking. This multivitamin is not going to offset the other things that you're doing. And again, save that money and spend it on all the nice stuff we have around here, especially in the summertime. There's lots of information out there you can use to kind of find this. I do share this with some patients. So the PSTF website is pretty publicly available. The 2022 review is there. The 2013 review is also there. The Cochrane Library is somewhat publicly available. They've got some very nice reviews on all these same topics. They have one on multivitamins. They have one each for the individual constituents. They've got their own vitamin D, vitamin E, vitamin C review. So the Cochrane Library is a nice source. And then lastly, if you've not used NIH's website on this for a while, it's going to be a very nice place to go to. And I've sent this link to patients and to providers, but they've renamed themselves. So they're now the National Center for Complementary and Integrative Health. So they no longer use the word complementary in their title. They felt that was a little bit insulting. They were not complementing medicine. They're kind of integrative with medicine. So it's now NCCIH, not NCCAM, but at least, again, for now, our federal dollars go to support this website. They do a lot of pretty good work. They're constantly culling the literature and updating what their site says. So again, NCCIH. Easy to find if you go there. Just Google kind of health or supplements NIH section. It'll kind of take you there. They have their own dietary supplement fact sheets, and they're actually pretty good. And they're kept pretty up to date. They also have them in at least Spanish and I think several other languages. If you go to the dietary fact sheet section, click on A, see there are all the options for A, including at the very bottom there, vitamin A is there. So all the vitamins are listed, along with other A things that your patients may be taking there. So acai, alfalfa, aloe vera, anabolic steroids, certainly not recommended, but lots of options there you can click on the A's. And again, pretty up to date, pretty well maintained sheets, generally not more than 1 or 2 pages kind of total and pretty easy to read. There is actually a specific section for vitamins and minerals. If you click there, just basically kind of get the specifics for vitamins. It's the same sheets that occur at the main page, but kind of a bit easier to find. I'll just share with you briefly what they say for vitamin D, because again, that's been a more popular vitamin, I think, the last decade or so. And people in this room may have been told you were vitamin D deficient or insufficient. So I'm here to reassure you, you're just fine if your level is 20. But if you look at the vitamin D site at their webpage, here's the things they have. There's a sheet for consumers. There's a sheet for health professionals. There's a sheet translated to Spanish. And at the bottom there in the small font, I just kind of enlarged it. There's their summary statement for vitamin D, which certainly doesn't include the latest data. But it says vitamin D does not reduce CVD risk, even for people with low vitamin D levels. And studies to date do not indicate that vitamin D with or without calcium reduces the incidence of cancer. So again, pretty plain language. They don't kind of mince words. They basically say, at least as far as this goes, it doesn't work. My guess would be alfalfa doesn't work either, and ASI doesn't work either. So if you have someone who's taking those and you think this is a harmful distraction, they should be doing other healthy things. These sheets will probably support your point of view and can be a nice thing to share with patients. So it's a pretty user-friendly interface. No matter kind of what you pick there, I find is every time I go there and kind of cruise around, I eventually find my way back to this statement, using dietary supplements wisely. And there's a nice statement at the bottom, just says there, most research shows that taking multivitamins does not result in living longer, slowing cognitive decline, lowering the chance of getting cancer, heart disease, or diabetes. So again, they don't mince a lot of words and basically saying that most of this stuff doesn't work. But now you've got the NH behind you and official looking sheets you can print out and give to patients. So again, a nice website at NCCIH if you've not used it. So I think key take-home points for today, and I think it's up to all of us like how we're going to kind of use this in our practice and how we're going to implement it for our patients. But as a reminder, there are 13 human vitamins. They are all truly vital, but we need them in very, very small amounts, the benefits of which are averaged over time. So if you eat nothing for 2 weeks, you will have no manifestations of vitamin deficiency. It takes a long time to manifest deficiencies. The recommended daily allowance again is not a personal goal. And 97% of all of us and our patients can live on less than that amount. So not something you need every day, but just averaged over time. Vitamin C does treat scurvy and vitamin D does treat rickets, but prevention of disease or health improvement of health in patients that don't have deficiencies has not yet been demonstrated. I think as providers, it's okay for us to be skeptics. I think that's kind of our job. So certainly as a pharmacist, when a new drug comes out, I kind of see my job as like, where should this drug not be used? What does this drug not do? It's okay to be a skeptic in the healthcare field, but also, as I say, okay to support our patients' choices as long as feel no harm is being done. So perfectly happy to let patients take their vitamins as a form of benign prevention if they feel they're helping. I think last, be aware that there are safety issues. Contaminants do get into these products. So if it says it's for male sexual health or GI health, it may contain a proton pump inhibitor or sildenafil. So be aware of contaminants that are added or unintended chemicals that may trigger allergic reactions. So, but if no harm is being done to the patient, again, I think we have to decide how we're going to approach this with our population. So with that, I'm happy to hear your guys' thoughts or how you're approaching it. Usually when I give a talk along these lines, someone in the room is taking supplements. So if anyone wants to volunteer that, happy to chat about that as well. But a fascinating topic to get into, I think, with patients. And again, I've kind of seen this as a bit of a gateway drug. Patients rarely volunteer to us they're taking them, but if you ask them, they will tell you, and then it can open up a nice discussion of why is it you're doing this and what else can we talk about that might help? How can we maybe achieve your health goals differently than with the supplement that you're taking? So with that, I'm happy to take questions. And again, happy to hear from you guys by email in a week or a month if some question occurs to you. So otherwise, nice to be back at Providence again. Hopefully it won't be 8 more years before I see you guys again, but thanks for the invitation and happy to take questions. So thank you.
Okay, we'll get right into it.
This was wonderful. Thank you. Have you put together what I assume is less than a 1-page sheet or the NIH of when are supplements helpful? Yeah. So, thiamine to prevent Wernicke's and I don't know, preservation for the retina. I'm not actually sure.
Yeah. No, it's a good question. Like when should we be using these? So, and again, there are, I'd preface by saying these are kind of otherwise healthy adults. So this is not, thiamine, obviously you're thinking there's a reason that person's deficient in thiamine. So I'd say if there's not in the setting where you're not worried about a specific deficiency, it'd be a really easy sheet because there's really nothing on that sheet. So yeah, this talk is really aimed at those of you in this room, and I assume no one here is getting 98% of your calories from alcohol and consuming very little food. Although it's interesting to, defend, right? All the news coming out. Hopefully still no one's in that category, but it's interesting. And when you dig into the alcohol literature, again, it takes very little food to avoid deficiencies. So you can get 80% of your calories from alcohol. And as long as you're getting some food, you're probably not going to need thiamine and you're not going to develop scurvy. So, I see a lot of people, a lot of severe alcohol disorder. I've seen 2 cases of mild scurvy in 20 years up at OHS. I don't know if anyone here has seen mild scurvy in the last 20 years, but it's almost impressive. There's not more of these deficiency diseases around, but again, it takes just so little of this that, so again, yeah, we could get into a talk on in those that have horrible diets that get deficient, where might you need things like thiamine or folic acid for adults trying to get pregnant. But I just preface saying this is for otherwise relatively replete patients, and there's really, for me, nothing on that sheet that I recommend. I have never recommended a vitamin to an otherwise healthy adult who I knew was eating food. So that's a good question. I'm still getting most of my calories from food too, but maybe a little bit more beer or wine at night. Yeah.
Again, this was great. And I also share your love for the Pandora's Lunchbox. It's an excellent book and would be helpful for people here.
I'll say there's another book called Vitamania, came out by a different investigative journalist that kind of doesn't go into the data, but does go into some of the other aspects I talked about. So Vitamania is another great book that came out about 5 years ago. But yeah.
Thank you. My question is, we have a lot of people coming into the hospital or in clinic or whatever who are on tons of supplements, some of which you've probably never heard of, and you were wondering if that supplement is causing a problem that you're seeing, like a liver injury or whatever. Do you have a good resource to recommend that actually looks into like what are the potential adverse side effects of these? And it might be the NIH one that you pulled up, but I find that information is sometimes not easy to get.
No, you're right. And it's, and honestly, I'm not a lot different from a lot of you. If it's a product that NIH website is pretty good, but a lot of stuff is not on there. So, and it's really, you have to have, there needs to be some data out there for them to comment on. So it's not intended to be kind of a catch-all reference for every supplement out there. So I will often just start with a Google search and see if I can find something published somewhere. And you'd be surprised how often you might find a paper somewhere by some small lab in Missouri or Wisconsin or another country that has actually published. So actually, if I cannot find it on the NIH's website, I will often start the Google search and then see if I can actually find a reasonable published paper. Because a lot of people have taken these supplements and just given them to 20 adults and seen what happens and measured lab values. And sometimes you can find something that's actually surprisingly valuable. Otherwise, if I come up totally empty, if you do have a concern, and usually I'm always looking for a temporal association of some supplement and some things. So I feel like I've been taking this for 10 years and you got, 9 years of normal LFTs and suddenly it's not that product. So, or again, a new rash appearing, I want to know what's new. So generally speaking, I'm looking for a temporal association. And if I can't find any good literature and I'm worried your transaminase is bumped because of this, I'd strongly recommend let's go off this for a month or two and recheck this and just do the kind of old re-challenge test. So yeah, nothing magic, but I'd say again, if you've not used the NIH website much, if there is data out there, it's a pretty good source to go to. Otherwise, I'm using Google searches and looking for reasonable publications and respectable journals like probably many of you are already doing. So, but yeah, a trial period off. And you can usually talk patients into that fairly easily. If they say, I started this recently and I've got this new rash, so let's go off this for a while. They're usually pretty amenable to that. So, yeah.
Great. I'll just add to that a couple comments and questions here online, including from our system librarian. So the library offers a database called NatMed, which is a pretty useful, comprehensive resource about supplements and natural medicines. So we have that available to us, including through our library site.
So I think that's there's a natural medicines database. It's an offshoot of Prescribers and Pharmacists Letter, which I've been on the editorial board for a long time, and I used to be on that one. It is a great place to go to. I still find like a Google search and looking for a good paper. Sometimes I find the stuff that's in that natural medicines database, it's not peer-reviewed things, but you can find useful stuff there. It does have references in it. So, but again, I find a good old Google search pretty helpful. So yeah.
Great, couple options available to us. Yeah. And I'll pull a question online. Last year, I saw a small study stating that an increased intake of one of the B vitamins, I think it might have been riboflavin, might be helpful in preventing dementia. Do you recall this specific study or any comments on B vitamins and dementia prevention?
No, not that one in particular, but I think especially with what B vitamins do, back to kind of thiamine and Wernicke's and a natural offshoot of thiamine can help Wernicke's might be, do the B vitamins play another role in kind of mental health? will say that I did take out about 10 slides around. If you just look for kind of supplements and general health, there was a study 2 years ago, a large trial that was randomized, and one of the B vitamins did come out as there was a subgroup analysis, and in that subgroup analysis of relatively healthier patients, there seemed to be a trend for slowed cognitive decline and a pretty complex battery of tests that were administered in the office. So again, I think even the USPSTF would say we can't rule out that some small subsegment of patients somewhere might not benefit. And so, yeah, I would not stand here and say B vitamins have no role in 80-year-olds that are showing some signs of cognitive decline. I would very much put that in the benign prevention category of how I approach vitamins. If this is an older adult who's, again, not smoking and has a relatively healthy lifestyle and wants to take a B vitamin, there is, again, it's kind of, from my take on it, kind of subgroup analyses of larger trials suggesting small benefits. But again, there are benefits you see when you do very complex inter-office questionnaires. It's not a benefit you're going to, be able to see or assess clinically yourself or even the family members. But yeah, I would not stand here and say that there might not be some small benefit of some B vitamin for cognitive decline. But there's certainly no data I can stand here and present saying we should be using this or should be recommending it to our patients. But I would put that again in the category of benign prevention if a patient wants to try that. So. Yeah.
I'm interested in iron for menstruating people. And I feel like here's all these like potential benefits that turn out to be untrue. And then here is this like huge population that is under ironed. Do you have any opinion on either, are they not actually under ironed or is it all just the money? Like there's no money in iron.
No, they are. So kind of like the question of like, thiamine for your alcoholic patients, Wernicke's. You can certainly, otherwise healthy adults can develop deficiencies depending on, in the case of alcoholism, drinking alcohol. But in this case, yeah, for young menstruating women, if they are anemic and iron deficient, then absolutely. But now, like our vitamin C for scurvy, you're treating a deficiency of something that we know can happen. So, and yeah, definitely young, healthy menstruating women can become deficient in iron. So if their ferritin is, I think Dr. Dyer would say anything under 50, we'd all agree certainly a ferritin under 30 with anemia, yeah, you've got iron deficiency. And that is a population that is most at risk. But now again, you're not giving a supplement, otherwise healthy population, you're treating a specific deficiency in a specific population. So yeah, absolutely use iron for those with anemia. But again, don't use iron in those that aren't anemic, and there's no otherwise health benefit of iron like the other micronutrients for those that don't have anemia and don't need it. But yes, that's a population that might actually need it.
I have a questions on folic acid supplement for healthy, expecting to be pregnant or just sexually active women. The USPSTF still recommends that supplement, but that guideline I think came out in 1996. Since then, we have done extensive public health intervention by fortifying our grains. And I want to ask if there are any new updated data on this topic, and are we just doing not the most evidence-based thing by recommending a prenatal vitamin to all healthy, sexually active women?
Yeah, which it's a good question. You're welcome to recommend multivitamin as long as it has that recommended folic acid in it. But yeah, in the latest 2022 guidance, the USPSTF says specifically, we still recommend folic acid for women who are trying to become pregnant or might become pregnant. That's obviously just for the kind of fetal health. And they say you can use a multivitamin to get that if you want. But the multivitamin then is really for the folic acid. So you're welcome to use the folic acid instead of the multivitamin. There's nothing else multivitamin that USPSTF found to be beneficial even in that target population. But yeah, the folic acid recommendation stands, and that has been for quite some time. To your point, though, we have put more folic acid in a lot of foods that people eat, but there's kind of an certainly carb, anti-grain. People may not be getting that benefit. So the USPSTF still says give folic acid to women who might become pregnant. It's definitely a benign, falls squarely into that, at least benign prevention in a small population. Probably actually has benefits. That folic acid deficiency does still occur for some pregnant women. So it is still recommended. It was the exception and the carve out to the generally don't recommend vitamins for adults. But yes, that's still a recommendation. And mid-90s sounds about right for when they, declare conclusively, this definitely works. We definitely should be using this. So yeah, still recommended.
Great. Well, I know we are coming up on 9 o'clock. Thanks so much for everyone's questions, and particular thanks to Dr. Williams.